Hi guys, I've got a super exciting case for you today. It's single arch, lower arch ortho treatment without any IPR, without any extractions, all in a class 1 sort of mild to moderate crowding case. Okay guys, so let's get started on this one. So this lady, the main concern is her bottom teeth. So let's have a look at her pre-op photos. If we go here, you can see that this tooth here is the main thing that she doesn't like. Top teeth, absolutely fine with, no problems. It's just when she's talking, this tooth sticks up more than all the others and it really bugs her. Seeing it from different angles, you can also see that these, from 3 to 3, lower 3 to 3 are a higher level than all the premolars and molars. And similar thing on the other side. Okay, this tooth is an implant. Actually, I can't remember if it's this 6 or that 6, but one of them is an implant, so I'll come to that later. And if you look at the occlusal shot, apologies for getting the lip in the way. You need a proper lip retractor, and this doesn't happen. These are cheek retractors we're using here. But you can see the level of crowding. I'd probably estimate that at about 6 millimeters, 7 millimeters of crowding. And remember, we can't actually procline these teeth anymore because the upper teeth are in the way. Okay, so that's going to be important because I did this case with very little. I can't even remember if I did any IPR, but it was. It's a case where immediately you think either a lower extraction or a lot of IPR, but there is another way. I'm going to show you that now. So I'll quickly just show you exactly what I did, and then I'll explain to you why I did it. So we just got the braces on. You can see here it goes up to the 5 and 5 to 5. Just because remember we've got implants and crowns on the 6s, didn't really want to damage them, but I don't really need them either. Okay, so start normal process, 14, 16, 18 night eye, and let it just do its work. But where things get a little bit interesting is when we move into stainless steel wires, because you can see I've added a little bend here and here to help achieve what I want to achieve, and the end result you can see is pretty nice. Everything's all level. You can see that the canines, premolars are the same level. Incisors here, there's a little step, it's a little bit lower down, but on this side it's all pretty much the same level. Okay, this is lowercase only. We didn't do anything with the top. We did very little IPR, and then she's retained in this position, super happy, and yeah, case is finished. So let me explain to you how we got the space now and the theory behind it. Okay, so if we say this is the top incisor, okay, and then this is the lower incisor here, what we're actually going to do is the initial point of contact is here somewhere. We're going to move it down here, right? And this is going to require, we'll split it up into 2, although it happens all at once, is a bit of intrusion down there and then proclination out there. Okay, so notice we haven't moved the position of this top tooth at all, but we're going to have it so that the lower incisor sort of contacts down there, and it'll tip forward a little bit. And this process is going to give us a little bit of extra room, and we'll be able to level out the incisors and make them all look great. Right, so this is the occlusal shot, and if you can imagine, the lower incisors are probably biting, somewhere back there. Maybe not so much, but you get the idea. And that one tooth that she doesn't like is set back even further, so that's up here somewhere. But it's not in contact with the palate. We haven't got traumatic occlusion or anything like that. So what we're going to do is make the new position, the new incisal contact, in this kind of position here. So you can see that from our first line, if we move everything out there, that we've actually got more of an arch circumference. We've gained a couple of millimeters just by intruding and proclining the teeth like this. Remember, no IPR. We're not going to change the position of the upper teeth in any way, but we are going to get space by using this method. Right, that's it. Easy, right? So I hope you enjoyed it. If you did, please share this video if you think other people will find it useful. If you want to get in contact with me, you can always leave a message either on the website, on Facebook, Twitter, Instagram, Snapchat, whatever. I'll always get back to you. Until next time, I'll see you later.